Hi, I'm Dr. Rajdeep, gastroenterologist at the Gastrocure Endoscopy Center and Liver Care Clinic in Thane. So we'll talk about colonoscopy. Colonoscopy is basically the examination of your large intestine with a flexible endoscopic tube called as a colonoscope. So when are the times that you should undergo a colonoscopy, or when does a doctor recommend that you undergo a colonoscopy? So when you have severe abdominal pain, if there is an unexplained weight loss, in case of family history of a colon cancer, you are recommended to undergo a colonoscopy. In case of severe bleeding per rectum, that is the time that you undergo colonoscopy. What are the conditions that we can diagnose, we as a gastroenterologist can diagnose based on colonoscopy? So inflammatory bowel disease like ulcerative colitis or Crohn's disease are regularly diagnosed with the help of colonoscopy. Then we can also pick up early colonic cancer with the help of colonoscopy and biopsy and help us in treating the patient before it is too advanced. Then there are conditions called as colonic polyps, which can be diagnosed in a colonoscopy as well as removed at the time of colonoscopy before they go on to become cancerous. However, not all colonic polyps are cancerous, so that also helps. The colonoscopy also helps us to differentiate between cancerous and non-cancerous polyps with all the advanced imaging techniques that we have. Colonoscopy also helps us to know whether the patient has bleeding piles or bleeding hemorrhoids and whether the patient would require surgery for the same. Also it is recommended that a person who has family history of colon cancer should undergo a screening colonoscopy after the age of 40. Also, patients who have had a surgery for colon cancer should have a surveillance colonoscopy done at regular intervals as recommended by a doctor to rule out that there is a recurrence of the cancer or if there are new cancers at other places in the colon. Patients with inflammatory bowel disease such as ulcerative colitis or Crohn's disease should undergo periodic colonoscopies to see the severity of the disease or whether the disease is improving or worsening. Hence, it is mandated that you visit your gastroenterologist to understand more about colonoscopy and why it should be done.